Hi, in this video, we will learn about breastfeeding in preterm and sick babies. Some babies are born preterm and some are born sick with fast breathing or other problems, and because of which these babies will need admission in intensive care unit. And here in this video, we will learn how to proceed with breastfeeding in these sick babies. So who are these sick babies who will need an NICU or neonatal intensive care unit admission? These are babies who are preterm, who are born before 37 weeks of gestational age, who are low birth weight, who have weight less than 2.5 kilo, or who have breathing difficulty, who has infections or sepsis, or babies with low blood sugar, which is called hypoglycemia, needing IV fluids, babies with jaundice, which is very high, needing exchange transfusion levels, and babies who do not cry at birth, even after 5 minutes, babies with recurrent vomiting, green colored vomiting, abdomen distended, stomach is distended, babies with heart disease, babies with low blood pressure, and babies with reduced urine output, and unstable babies with congenital abnormality, and babies with seizure. These are in general babies who will need ICU admission. And these babies will not be able to be directly breastfed because they are separated from the mother, and they are also not able to keep with skin to skin contact with the mother. They are separated from the mother. They cannot be kept on skin to skin contact initially. So what we usually do is babies who are on ventilator, whose blood pressure is less, we allow the mother to touch the baby and speak gently to the baby in a developmentally supportive way. But babies who does not require a ventilator, who are not in shock or low blood pressure, we encourage the mother to hold the baby and if possible, do skin to skin contact or kangaroo mother care. Now, these babies, especially the preterm babies, direct breastfeeding may not be also possible because they are not able to suck the breast effectively. They are not able to coordinate sucking and swallowing or coordinate the swallowing and breathing. So usually if we have to swallow milk, the baby has to swallow milk. The baby has to coordinate the swallowing and breathing. The baby cannot swallow when it is breathing, and that is called the suck swallow breathing coordination. And this breathing suck swallow breathing coordination comes at around 34 weeks of gestation age. So babies may have to wait in NICU before getting discharged till 34 weeks of gestation age. And till that period, the babies are usually fed with orogastric tube, feeding tube. So as soon as the baby is delivered, the mother has to express the milk. So usually within 6 hours, the mother should be given realistic expectation that initially the milk volume will be very little. Maybe there is no milk, or when she tries again and again, every 2 hourly, few drops of milk comes in the first 24 to 48 hours. And there may be considerable delay before more substantial milk production comes. So this is a diagram describing the various steps of expressing milk by hand. So mother can use express the milk by hand or using pump, and the pump is again manual pump or electrical pump. So we will go into each of it in detail. So expressing involves massaging the breast and bringing the milk towards the center, and then holding the areola with the thumb and the index finger and other fingers in a C-like fashion and pressing the breast towards the chest and then inwards. At that time the milk comes out, and you should keep a sterile container below to collect the milk. Or you can use a electric pump or a manual pump to express the milk. So initially the mother may become discouraged if she is not able to express large quantities of milk. So assure the mother that no amount is too small to save the baby. You can use a 1 ml or 5 ml syringe to measure the milk expressed, which will help the mother feel better. So mothers usually go with the feeling, right? So she should have a good feel about her milk output. And mother should be encouraged to express at least 8 times in 24 hours, because any break in the frequency of effective milk removal at this time can reduce the maximum milk output. So it has been shown that mothers with low birth weight who produce adequate milk volume pump at least 8 to 10 times per day, or at least more than 6 times a day. Now, the key to establishing and maintaining a full milk supply over time is by expressing the milk early and often, and expressing long enough to drain the breast, and sticking to a daily routine. Begin expressing breast milk as soon as possible, ideally within 6 hours of birth, for at least 15 minutes from each breast, for at least 8 to 10 times a day. And also express the milk or pump the milk at least 4 to 5 times during night. The pumping should be long enough, 2 minutes, even 2 minutes after the last drop of milk has come, or for 30 minutes, whichever comes first. Using an 15 to 30 minutes. Using an effective breast pump is critical to establishing good milk production. Double pumping breast pumps are also available, which cuts the time spent in half and increases the milk supply more quickly. So, for effective expression of breast milk, the mother has to wash her hands with soap and water and sterilize the breast pump and the feeding utensil, and do not wipe the breast. Do not express in the same container every 2 to 3 hours. She has to always sterilize the container. What do you mean by sterilization? It is you are killing the bacteria in the utensil by first washing the utensil and the breast pump with the soap and water, and then washing with warm water, and then keeping the breast pump and feeding utensil submerged in boiling water for at least 15 minutes. She can do kangaroo mother care as much as possible, and if the baby is having vomiting, then she should at least wait for 1 hour after the feed to do kangaroo mother care. That will also help in increasing the milk output. The manual expression, that is expression by manual breast pump or electric breast pump or by hand, should be done as early as possible for long duration, 15 to 30 minutes from each side. And manual expression breast pump should be done every 2 to 3 hourly, including 4 to 5 times at night. The mother should take rest. That means she has to sleep during daytime also, because at night also she has to express at least 4 to 5 times. Then drink adequate water. Maybe she can take 2 glasses of water each time, like that 8 to 10 times. And then eat only homemade food, because outside food may be problematic, and the pain reduces milk. Therefore, it is important to control the pain. If it is a C-section, then she can take pain medicines at least for 2 days. By 2 days, the C-section pain will go. After 2 days, usually the back pain starts, and therefore she has to get a back massage done, usually by her mother or the husband is there. But since husband has to go for work, then our grandmother can join to help do the back massage at least 4 times a day for 10 minutes each if there is pain. And the massage should be done with a thumb in a circular and a straight fashion on both sides of the spine. And it should not be done on the spine, because if you massage on the spine, the pain may increase. Self-belief is important. The mother should repeatedly say to herself that she should imagine that she is having milk flowing from her breast, and it is keeping on increasing, and the baby is suckling and is getting happy and sleeping because of her milk. And galactose. Galactose are medicines which are supposed to increase breast milk, and thus there are food items also which are supposed to increase breast milk, like fennel, green leafy vegetables, oats, and expression of breast milk. Now, breast milk can be expressed with the hand, as I have already told you. For that, you have to wash your hands with soap and water, then sterilize the container, that is washing with soap and water, then warm water, and then keeping it submerged under boiling water for 15 minutes. Then massage the breast gently towards the nipple and place the thumb and the index finger opposite to each other. The mother has to do herself. She should not tell others to do, because only she knows the pain, and there should not be any pain while expressing the milk. So the thumb and index finger should be placed outside the areola, and it should not be placed inside the areola. It should be outside. And the mother should then press the breast backwards towards the chest and then gently squeeze inwards to express the milk. So the step 5 should be repeated at different positions around the areola. So same thing is again repeated. Gently squeeze the areola, the breast beyond the areola with between the fingers, and release the pressure, but do not lift the fingers off the breast. This process of gently pressing backwards and squeezing inwards and then releasing the pressure should be performed repeatedly and rhythmically. So expressed breast milk can be done with the hand expression and as well as the pump. It is usually done in preterm and sick babies, or where the baby cannot directly suck, or when the mother is sick, or when there is local breast problems because of which direct feeding is not possible. And after 6 months, once the mother joins work, she can express the milk and give the baby using spoon or cup feeding. So for cleanliness of the mother, she should have daily bath and wear new clean dress. Avoid ideally undergarments. Keep the areola nipple area dry, and do not wipe the breast again and again. Do not wipe, because the clothes may also contain bacteria which can cause infection to the baby. Wash her hands with soap and water and sterilize the utensils and the breast pumps. And the mother should be always gentle while expressing. If there is pain, the technique is wrong. Do not touch the nipple or the areola while expressing. So initially, there may be less milk, but resist the temptation to use more force. After 5 to 10 attempts, the milk will start to drip out, and as the procedure continues, the milk starts to spurt out. Now massage both breasts from periphery to the center and express from both breasts. When the flow slows down, move the fingers to the sides of the breast and express in this new position in the same way, and then express from the other breast. The whole process may take 20 minutes from each breast. Low birth weight baby who are not able to breastfeed directly have to be given by feeding tube or spoon feeding. Now this is the breast pump, which is the electrical breast pump. There are different brands available, and you can sterilize before each use. This is a manual breast pump, and manual breast pump on one side, left side, and this is the electrical breast pump from another source. And express breast milk can be stored to 4 hours in room temperature if you close it with a lid, and it can be stored up to 24 hours with a fridge, or up to 3 to 6 months in a deep freezer. Now back massage is very important. As I have already told you, the back pain usually comes after 2 days because of repeated sitting and expressing the milk. She can feed the baby even in lying down position, but anyway, since the baby is preterm, the baby will require express breast milk. The mother can have her back massaged using thumb. The person who gives the massage should use her thumb, and the massage should be done on both sides of the spine in a circular and a straight fashion. At least 3 to 4 times a day for around 10 to 15 minutes. Kangaroo mother care is also important. And in preterm babies, you can do, even if the baby is having breathing support, you can do kangaroo mother care. In this picture, you see a mother who is doing kangaroo mother care or skin to skin care for her twin babies. Both babies are held together. Now starting the feeds. The feeds are started if the baby is not having low blood pressure or surgical intestinal disease. If the baby is having respiratory distress, requires support or fast breathing or less than 34 weeks or swallowing dysfunction, then we feed by feeding tube. Then you can use the mother's own milk. That is the first preference. Then if it is not available, you can use a donor human milk, pasteurized donor human milk. And if both are not available, then feeding formula feed. So depending on the gestational age, the initial mode of feeding will vary. Less than 28 weeks, we start straight away IV fluid. 28 to 31 weeks, we start with feeding tube and orogastric tube. IV fluid may be there, and gradually we increase the feeding tube, the feeding through the tube. Then if the baby's gestation age between 32 to 34 weeks, then tube feeding will be there. We will start the spoon feeding also, and we will gradually increase the spoon feeding to full feed. And if the baby's gestation age more than 34 weeks, then spoon feeding is there. We will initiate the breastfeeding, and gradually we will start by increase, and by 37 weeks, the baby will be fully on breastfeeding. So this is the guideline which I have already told regarding the route of feeding. So if it is less than 28 weeks, then IV fluid and small amount of feed will be started, and it will be gradually increased. And 28 to 32 weeks, we will start with feeding tube. IV fluid will be there, and we will do non-nutritive sucking. That means the mother will express her breast and empty the breast, and then allow the baby to suck. There is non-nutritive sucking. So this is a picture of a feeding by feeding tube, that is also known as the gavage feeding. And between 32 to 34 weeks, the baby may be on feeding tube. We will start slowly the spoon feeding. This is also known as the pallida feeding or Gokarnam feeding. Now, Gokarnam means the spoon is in the shape of a cow's ear. So Go means cow and Karna means ear. That's how the name has come. Now, during the spoon feeding, the newborn should be in a semi-upright position on the caregiver's lap, and her arms will be covered, and the baby's lips will be touched with the spoon, and the spoon will be tipped it in slightly so that the little milk enters the mouth. Allow her to suck the milk, and do not pour the milk into her mouth. Stop the feed when the desired quantity is given or she is no longer interested. Do not forcibly feed a crying baby or she may choke. And do not use bottle feeds or droppers, as they are difficult to sterilize and cause infection. And once her sucking becomes more vigorous over the next few weeks, she can be gradually weaned off spoon feeding, and totally she can be fed by the breastfeeding. So infants on IV fluid, how we will progress the milk? We will start the small amount of milk, and we will increase the feed volume. And the feed will be given through feeding tube. And at 30 to 32 weeks, we can start small amount of spoon feeding, gradually increase the spoon feeding by around 34 weeks. And once the baby is at 34 weeks, we will start on mother's milk, the breast milk, and direct feeding. And once the baby reaches around 37 weeks, the spoon feeding will be stopped, and the baby will be totally on the direct breastfeed. Some babies, extreme low birth weight baby whose birth weight is less than 1 kilo, we will start the baby on IV nutrition only, which is called parenteral nutrition or total parenteral nutrition. And the oral feed will be gradually started if the baby's blood pressure is stable. If the baby is more than 34 weeks, then the baby will be started on breastfeed. The baby will be already on spoon feeding, and gradually it will be increased. So this is direct breastfeeding of a small preterm baby using the football hold position. It is called football hold position. The baby is held like a football in the mother's axilla using the hand of the same side as that of the breast. The hand holds the neck of the breast of the baby, and the baby is fed. The baby can be supported with a feeding pillow, and the mother's back can be also supported with a pillow. And as the baby grows, we will monitor the increase in the weight of the baby, head circumference and length using growth charts. So when the baby reaches 1.6 kilo weight or gestation age is more than 34 weeks, we will plan the shift of the baby. If the mother is confident of taking care of the baby, she is doing direct breastfeed followed by spoon feeding till 37 weeks or 2.5 kilo weight, whichever is later. And thereafter, the baby will be on totally direct breastfeed only. And fourthly, the baby should gain weight consistently at least 20 grams a day for at least 3 days, and then the baby should be free of disease. At that time, we will try to discharge the baby. Now, to increase and maintain the mother's milk for the preterm baby, she should start pumping the breast milk early and for long duration, and for frequently, at least 8 to 12 times a day. She should have adequate water, diet, homemade food, and sleep, especially in the daytime, because she has to express the milk even at night, at least 4 to 5 times. She can get her back massaged on the sides for back pain at least 3 to 4 times a day. Skin to skin care is also important for increasing and maintaining the breast milk. She can use galactose, which are medicines for increasing breast milk, and she should have a good self belief that she will be able to produce breast milk even for twins or triplets. She should be able to produce the milk, and there should be hygiene, that is, wash hands with soap and water and sterilize the feeding utensils and breast pump before each use. That is, washing with soap and water, then with warm water, and then keeping it submerged for at least 15 minutes in boiling water. So with that, I end this video. Hope you understood how to increase the breast milk in a preterm baby. Thank you.